So hello, my name is Jordan and I'm a social worker at the Thorpe Recovery Center. I provide support to those we serve by facilitating opportunities and resources that will aid them on their recovery journey. The Thorpe Recovery Center is an accredited nonprofit treatment center for those with substance use disorders. And today we have with us Becky Walker, and she is the Family Engagement Coordinator for Midwest Family Connections, MFC. MFC is designated as an Alberta Family Resource Network hub for Lloydminster in the County of Vermilion River. Yeah, awesome. So I guess just to jump right into it, what is the relationship that MFC has with the Thorpe Recovery Center?
So currently we're delivering the Kids Have Stress 2 course to those who are at the Thorpe and who may be interested in it.
Yeah, exactly. Yeah, and we found that those presentations, because it's a two-part presentation, and our clients as well as our staff who has sat in on it has found it super beneficial, and it's brought about a lot of different questions that people might have too, and different techniques, coping mechanisms that we can teach children, not only for people who who have their own children, but for people who may not be a parent, but have children in their lives or have family or friends who have children. So we always try to voice that to our clients here, that you don't have to be a parent to partake in the course, because all this information can be so can be distributed to so many different people.
And even in itself, us as adults, we can take those strategies and they can be beneficial for us as well. It's not only beneficial for the children, but it's great for us and things that we can model and do ourselves.
Yeah, for sure, exactly. So how long has MFC been in service, and are you guys a nonprofit organization?
So actually, Midwest Family Connection was incorporated in 1982 as a nonprofit, parent-driven organization.
Awesome.
Yeah, we were established to provide early childhood intervention services to families of preschool children who had or were at risk for developmental delay. Since then, over the years, we have evolved from being like a small organization with a couple of staff and just one funder to being quite a larger organization with lots of different funding coming in. And now we serve all kinds of family-centered programs, services to families and caregivers with children 0 all the way up to 18 years of age.
That's amazing. Yeah, I've heard so many great things about MFC and just all the different programming that you guys offer as well. And so I guess talking about the programming, how has that changed for you guys due to COVID?
So obviously with COVID, that's changed things for most organizations, I would say. For our community-based programming and our group programming, we've obviously had to put that on hold in person. But we have opened up our indoor playground for individual family booking times. So families would just come, they can just come in, like we have set times, and it does book up really fast.
I bet.
Yeah. And then we're running some virtual sessions through Zoom and of parent education sessions. We've got some coffee sessions and stuff where you can meet up. We have parenting curriculums that we run as groups virtually, but we can also meet with parents one-on-one in our center.
Okay, cool.
Yeah, for our home-based services, which is a little bit more support, we have throughout the whole pandemic, we've been continuing to support families either virtually through Zoom, over the phone, and now they can meet with us one-on-one in center.
Oh, that's wonderful. That's so awesome to hear, because like we recognize, especially here at Thorpe, like utilizing those like resources such as yourself out in the community, especially during times with COVID where people feel like that isolation, it's nice to know that they still have that option of that support to go to you guys too.
For sure.
Yeah, exactly. And so I guess along with that, you've kind of touched on quite a few of them already, but the services that you guys offer, and are these services free, or do you have a fee for some of them?
So all of our services are actually free. We offer programming services and support around family dynamics, family resiliency, knowledge about child development, parenting practices. We can help facilitate connections to community and culturally relevant supports as well. support can be short-term or long-term. So it can be like a one-off support request. You need a little bit of information. It can be more like, consultative services for a short time, or it can be longer term, depending on the goals of the family and within our program guidelines. We also have some specialized programs. So we have ICC, which is inclusive childcare, where we support childcare settings to be inclusive to all children. We have the PCAP program, which is the Parent-Child Assistance Program, and that's for moms who have experienced addiction issues to help support them getting connected and prevent FASD births and complicated births because of addiction use. And then we have Preschool Mental Health Initiative, which supports those families who maybe have concerns around social emotional development for their children.
Yeah, that's so wonderful to hear, like, especially with mental health, like the stigma kind of dissipating a bit around mental health, and recognizing that we shouldn't just start looking at mental health when people are in their like early adulthood. We should start looking at it right when they're children, right? Because that's kind of where those mental health issues may start to arise a bit. So I love that you guys do that with like preschool children. Like, I had no idea. That's amazing. Yeah, that's super cool.
We actually have developmental questionnaires for children 6 and under, and part of that is a social emotional questionnaire to kind of track that social emotional development as well.
Awesome. That's fantastic. So how can somebody access your programming? Do you guys have a website where you kind of have all the information outlined on there?
So our website, we do have a website, midwestfamilyconnections.ca. It's currently under construction, so it might not have all of the current programming information, but it'll at least give the general idea of what our home-based services look like.
Gotcha.
Our Facebook and Instagram pages, though, are updated continually with upcoming program and posts. Perfect. Families can actually even ask to be put on an email list where we'll email out information to them of upcoming programs and everything like that. So.
Awesome. That's really good to know, because with these interviews, we also want to link like your guys' information, so that if people want to check out your guys' website or social media, they can do so just by clicking the link. So that's really awesome. Yeah. Okay. So are there any requirements to entering your program at all?
So right now, for our community-based programs and like the indoor playground playtimes, families have to call and register to book a spot. For home-based services, a referral can be submitted by the family themselves by giving us a call, or by an agency on behalf of the family with the family's permission. Depending on where a family lives, Alberta side of Lloyd, Saskatchewan side of Lloyd, rurally, in town, it will also determine the services available. We try to make sure everything is available, but some things are specific on where families live, but we still try and offer the same services. And if a family doesn't live in our service area, we can definitely help connect them to other agencies in their area. So for example, we're a family resource network, but there are also family resource networks all through Alberta. So so, and they often will have very similar parenting programs to what we're doing as well.
That's perfect. Yeah, because there might be people who are living like in the Lloydminster area but have to move, but know like about you guys and the services you offer. So that's awesome that you guys are kind of able to refer them to other agencies that kind of provide the same support.
Right.
Yeah, that's awesome. So are there any preconceived barriers for your programming that potential clients should not be concerned about?
Programs and services are open to all families. So it doesn't matter kind of your age, the demographics, your income, and your level of need. We're open and available to all families.
Love it. Love that. And do you guys have wellness and or like recovery plans? And if so, what are they?
So we do recognize the importance of self-care and being connected to the community and your relevant supports. So while we wouldn't develop wellness and recovery plans, we would work within our guidelines with different partners and agencies who help support the family to, so whether it's like attending case conferences, safety planning, court accompaniment in certain programs like PCAP, and looking at how those strategies can be worked into your daily life, your daily routine and stuff.
Right. Yeah. Perfect. Because I I think that's like a common thing, especially when that we find with clients here at Thorpe, is it that routine, right? Like it's that routine that really helps people to kind of stay on track. So, and even I know with myself, like when I'm out of my routine, I feel like I like don't even know what I'm doing with myself.
Right. Yeah.
Yeah. And I kind of wanted to go back to some of the programming stuff, because I remember when I was in the role, kind of getting Kids Have Stress Too and all that kind of stuff set up here at Thorpe. There was someone that had mentioned the Triple P program. Is that something you guys still do as well?
Yeah, so the Triple P is a positive parenting program, and that can be delivered, it's different levels and different layers of it. So it can be delivered as like one-off seminars.
Okay.
It can be done in like a discussion groups, or which are topic specific, like managing fighting and aggression, developing good bedtime routines.
Mm-hmm.
Then we have group, which is a longer set of sessions, but it takes a look at, you know, what are some positive parenting skills,
Right.
How to encourage those behaviors you want to see in your children, how to manage misbehaviors, developing a parenting plan. And it's a little bit more, you have a little bit more support within that to
Right.
implement things for your family.
Yeah.
And then we have it for like kind of the younger kids, like 2 to 12. And then
Right.
we do have staff trained to be able to deliver it for teenagers up to 16, like for families with teenagers with 16. Right. And you can also access it free online as well.
Okay, cool. Because the Kids Have Stress Too, that's part of the Triple P, right?
No, it's a different,
That's all different. Okay, gotcha. Yeah, gotcha. Because no, I just love the Kids Have Stress Too. And like, we've kind of been talking with you guys a little bit about like, oh, like, should we switch it up? And I'm like, why fix something that isn't broken? Because everybody loves the Kids Have Stress Too here. And yeah, we've even had staff members like want to sit in on the presentation too, which is amazing. Like, and the rooms are always full, well, as full as they can be with COVID because social distance. But you know, so yeah, it's been wonderful to be able to kind of work with you guys and utilize your services too to help inform more individuals on this really important information.
For sure. Yeah.
Becky, before we wrap things up here, do you have anything else that you would like to share regarding like Midwest Family Connections at all, or anything that we didn't cover?
Well, one thing about our programs is that they are all voluntary. So it's up to the parent whether they want to attend or not. If a family is mandated to take a parenting program, it's still optional on our end, right? You know, it depends. We understand that life can be complex. So we try and be flexible to help meet some of those needs, as far as, you know, if you can't join the virtual group that we have going on, how can we maybe deliver it to you one-on-one, right? So yeah, we really try and be flexible within our program guidelines to support families.
Yeah, especially with COVID right now too, and just trying to make it accessible for people, like especially for people who are still working or having to work from home, right?
Right, yeah.
Yeah, no, that's awesome. But thank you so much for meeting with me today. It's been a pleasure getting to speak with you. And yeah, I'm happy that we have your guys' continued support in our connection here, and that you were able to join us for this segment of Coffee with our Community Connections during COVID.
Thank you for inviting us.
Yes, of